at UC San Francisco was a double-blind study, and it was Dr. Cree took 80 patients, and there was quite a few patients from Sacramento that went to the study, and I'd had an opportunity to meet quite a few of them, and was active in questions that they had while they were on the drug. And it was funny because we were kind of trying to go back and forth. Well, is it LDN? Are we on the placebo? But his study is out and it's finished, and his results were good. It definitely said that it warranted more research. Dr. Cree is getting some of his colleagues to take a look at it, and I think when more research comes out, I think he's going to pursue it. I had an opportunity to speak to one of the gals that works with him during, while they're doing their research. And funding is a big, big issue with them, because a good percent, when they get funding, a good percent of the money that they get has to go to overhead. And it's like, no, you know what? Money that's designated to go to research shouldn't go to overhead. Because I know what I went through, and I know what I went through when in 05 before I got on LDN. And I know the self-esteem I lost for not being able to work, and just me as a person, and what I had lost with everything that I wasn't able to, what I wasn't able to do. Quality of life, I lost a lot. And I didn't want to see that happen to anybody. And I was always thinking, what could I do to raise awareness, to bring more awareness? Because the government's not funding the NIH the way they're supposed to. The government is not funding research that they need to research. And I thought, you know what, we need to reach out to movie stars. We need to reach out to sports figures. We need to reach out to the entertainment industry, because they dump so much money into AIDS, into cancer, into MS, and it's ludicrous that you send story after story, letter after letter to these foundations, and these people that read this information that you mail to them aren't medically or scientifically educated to make a decision whether or not they should pass this information on to that intended person. Bill Gates was a prime example. Donald Trump was a prime example. Governor Schwarzenegger was a prime example. I sent them stuff. I sent information to our Health and Human Services at Sacramento. I get the same thing, that you need to contact the MS Society. The MS Society isn't going to touch it. It's not profitable. They don't care. They don't want to help us. So it's not going to come from the MS Society. So I woke up at 3 o'clock in the morning one morning, and I thought, I know, I'm going to walk to the couch. So I woke up at 3 o'clock. I woke my husband up and I said, I've got it. I've got an idea. And he goes, Vic, it's 3 o'clock. Talk to me in the morning. I said, no, this is going to work. This is going to get more news coverage. It's going to get another article in the paper. And I said, it may be something that we're going to get to Governor Schwarzenegger with. I said, I'm going to walk from our house in Auburn to the state capitol, which was exactly 56 miles. So I plotted out my journey, and I decided that I could walk 10 miles a day in 3 hours. So I walked 10 miles a day in 3 hours, and what we did is we contacted as many people as we could, and we told them to mass email the governor's office and tell them that I was walking, and that he should either meet me on the steps or he should have one of his representatives there to meet with me to discuss this matter. So unfortunately, California, we have no budget. They were working on the budget. So he was tied up trying to figure out a budget. In the meantime, talking about California's broken healthcare system. And I told him, I said, when I went in and spoke to Governor Schwarzenegger's aides, I told him, I said, you know what? This is a perfect example to get him interested in researching and funding this research and getting with all of his people in the entertainment industry, because I'm going off of disability, I have a job, and I'm going off of Social Security. What better way to save not only California but the United States money, get people back to work, get them off of disability, give them a quality of life, get this research noted where it needs research. So we discussed it. I talked to them for an hour. They said they would look into it. We've been following up, but it's still been the same thing. Because it's all about money. It's all about money. I mean, this is my belief with the Cancer Society, with the MS Society. I mean, think about it. They're billion-dollar companies, and if something inexpensive comes in and all of a sudden wipes millions of dollars of revenue from their CEOs and, from their companies, and the drug companies aren't going to fund them anymore, it's not profitable for them. I mean, they're not, they're in business to make money. And as long as they have the government, and the lobbyist in the government, we haven't got a fighting chance. And I think that's why it's definitely a patient-driven cause. And that was one of the reasons for getting to Governor Schwarzenegger, because he is in the entertainment and sports industry, and he's got the connections. And the same with when I met Kevin Johnson. I've met with him twice now, and that's what I told him. I said, you know Magic Johnson. Magic Johnson, I mean, everybody knows the position that he's in. Dr. McCandless's work. He needs to know about Dr. McCandless's work. He needs to know what he can do to make an impact on not only California, but the United States and globally. So it gets frustrating because we send letter after letter after letter to different people, and it never gets to the intended person. It always gets to the secretary or somebody that's going to do their screening. I wrote Michael Moore a letter, and I told him who I was, and I just told him that I was an advocate, and that I just finished watching Sicko, and being a patient advocate, having to pay $750 for medical insurance, I mean, I hated that. That was one of the biggest things that I hated. And after I got on LDN, I couldn't make the insurance company see that I was really saving them a lot of money. So I just finished watching Sicko, and I thought, you know what, I'm going to write Michael Moore, because I liked the part where he said our government doesn't fear us. And I thought, this really does make a lot of sense, because our government doesn't. The only thing is just we need the research, because I know the first time that I met with Congressman Lundgren, they really wanted research. They wanted scientific documentation. They wanted something substantial, because we live in a sue-happy society. It's true. It's unfortunate, but it's true. If the minute something happens, no matter who advised us, no matter who directed us, if it doesn't work, we're going to go back and we're going to sue. So we've kind of started this whole affect ourselves, because the minute our doctors prescribe something to us and something goes awry, our first instinct is to sue our doctors. And shame on us for that, but we're desperate. We will go to whatever means it takes in order for us to get better. So we go to our doctors, we have them prescribe something that's not effective, or that may be effective, but they're not going to prescribe it because they don't want to get sued. I went through it with my own doctor. She was not going to prescribe low-dose naltrexone for me because she didn't want to get sued. I told her I would sign something. I said, I'll cut my arm off before I let any of my family members sue you. She said, with our insurance, with malpractice, with lawsuits, she says, we can't afford it. So I had to go elsewhere to get it, and then 3 months later I went in to show her that, look, I'm on the drug. Then I think once they see you prior to it, because I just got out of the hospital or out of the emergency room, and she had seen me right after I got out of the emergency room, and then she saw me like 3 months later. It was kind of like, okay, this is where I was, this is where I am today. Obviously, something has taken effect. But because they're so afraid of being sued, and because the government is in bed, I mean, it's no secret, I mean, with the drug companies, the government isn't going to be there because it's in their best interest to stick with the drug companies. They're not going to help us. I've lost a lot of friends to cancer. I've taken care of a lot of people before I got sick. When I saw them suffer, and when I lost family members and close girlfriends and people that I loved, and I just stood there because I couldn't do anything because I didn't really know the research in the medical field. And once I started researching, and I got on LDN, and I started reading and doing more research and finding out that there was so much more out there that was beneficial to us, but because there was no money in it, I was going to lose out on it. I don't want that. I don't want that. Quality is something that we don't get every day, and I've kind of gotten a second chance on life. And I will do whatever it takes to fight for these people, because I mean, I just consider us all a big family. We have to do this. When you have no light at the end of the tunnel, and you basically give up on life, it's a horrible, horrible place to be. And I did that in 2005.